Hi, I'm John Kanelopoulos, a eye surgeon based here in Athens, Greece at the Laser Vision Ambulatory Surgery Center, and part-time in New York City, clinical professor at the NYU Medical School in New York City, New York. And we'll discuss a little bit about one of our favorite subjects, or if you may, the subjects we are known in the ophthalmic community for over 2 decades now, that is keratoconus. And we have for over 15 years popularized an alternative to cornea transplantations for advanced keratoconus. We can see here an example. This is a patient that I personally operated on 3 months ago. This advanced cone 15-20 years ago was an indication for someone who could not cope with very difficult contact lens wear to have a cornea transplant done. So we can see how we went from here to here with the Athens protocol, our signature combination cross-linking technique, where we reshape the cornea with a very customized laser ablation, and then also use adjunct higher fluence cornea cross-linking to get a far normalized cornea. And this is the difference when we subtract the post-op 3 months later from the pre-op. And you can see how accurate the area of cornea flattening is for the cone, and how the upper part of the cornea that was flattened from the ectasia, we were able to reshape and re-elevate in order to create a more normal cornea. Of course, the best treatment is always prognosis and avoiding the reasons that cause keratoconus. And here in Greece, we live in an environment where we recently studied our cataract surgery population, which are people usually over 60, and we are astounded to find that 1 out of 10 has clinical keratoconus based on these topographic maps, and most of them without even knowing. And this was the time that they reached the level to have cataract surgery. We estimate that 1 out of 4 has suspicion for keratoconus. And we know that keratoconus is inherited, so you need to have the genetic predisposition from one of your 2 parents, and it needs another pivotal thing for it to develop, and that is eye rubbing. And the way keratoconus people rub their eyes is not the usual rubbing on the eye softly like many women do when they remove makeup, or we do when we have a little bit of itchiness. They rub their eyes with their knuckles. It's very characteristic. And I'll share with you 2 examples to underline the importance of eye rubbing. This is a gentleman that I saw yesterday, a 35-year-old gentleman with known keratoconus for 2 years. Usually 35 is the age where we're not concerned a lot about progression, because we feel that the years that have gone by have the ability to stabilize the progression of the keratoconus. So he's aware for 2 years now that he should not rub his eyes, and he doesn't do it obviously during the day. But if we look at his epithelial maps, these are the cornea epithelial maps with this fascinating technology by OptiView. We can see that the epithelium has remodeled drastically to accommodate the biomechanical forces that the patient is applying to his cornea. And we're absolutely certain when we see this picture, we've shared this with colleagues globally, that our patient is an eye rubber during his sleep. And indeed, after a careful questioning, he does sleep on his right eye, this is his right eye, and on his knuckles. So without him knowing, subconsciously, he rubs his cornea onto his knuckles. And this is an example where we expect the keratoconus to progress rapidly. Now we'll jump from here, and again, a 35-year-old gentleman to a gentleman that is 20. So in an age group that is much higher suspect, and I think all cornea specialists will agree, for keratoconus progression. And we can see that the keratoconus here in this 20-year-old gentleman, who also is aware of his diagnosis for 2 years and is also avoiding eye rubbing, at least consciously, is less significant than the one that we saw before. But the question arises, how soon should we see him? Should we have him videotape himself sleeping? Because we're obviously concerned if he rubs his eyes during his sleep. And this is the epithelial maps of that younger 20-year-old patient that is the exact opposite of the previous epithelial map that we saw. We can see that the epithelium here is naive. It's almost homogeneous, a flat green color, which for us is a reassurance stamp that the patient is not an eye rubber during his sleep. This gives us a lot of time and a lot of relief that we don't have to really follow him that closely unless his vision changes. Of course, we will not investigate in great detail the sleep pattern, because this is a naive epithelium indicative of non-rubbing of the eyes in a patient that we ordinarily would be more concerned. So I wanted with these two examples to underlie the importance of eye rubbing and how we have technology today to substantiate it and prove and document whether this happens or not. And I'm going to close with a do-it-yourself special mask that for those of our patients that sleep face down or turn in their sleep and rub their eyes either directly on their knuckles or even under the pillow, to make a do-it-yourself special face mask. This is nothing more than a sleep mask that you can purchase anywhere on the web or from travel accessory stores or from stores that sell cosmetics. It's kind of soft, so it's a little bit of cushiony. And this is an eye shield. This is a clear eye shield. Every ophthalmologist on the planet uses this, and you can obtain these from any pharmacy or pharmacy warehouse. If you cannot, contact us and we'll definitely share the information with you. So this is what a clear eye shield looks like, and we use it usually after procedures. We tape this on patients' eyes after procedure so they don't rub their eyes during sleep and they don't take the risk for an infection. But obviously you can't do this on a daily basis if you're a keratoconic patient. So you can use an eye shield in between two sleep masks. So sleep mask number one, we will place an eye shield in between, and then face mask number two. And then here we need a little bit of sewing skill to sew these two together and create a very comfortable face mask that will have a hard shell eye shield that has really soft borders, and will enable us, obviously we'll do the same thing for the left eye in this mask as well, will enable our patients to place this over their eyes, sleep comfortably, and rest assured that there will be no manipulation with their hands on their eyes, especially if they are more of the type 1 patient that I showed you. A very drastic tool, perhaps the most effective treatment to avoid the development of keratoconus. We've posted it on our YouTube channel, our Laser Vision YouTube channel, the drastic improvement in eyes that have have ceased eye rubbing in their corneas without any other intervention, and definitely no surgical intervention. So to avoid reaching a level of keratoconus that will need a procedure like our Athens protocol or even cornea transplantation, my advice is study the way you sleep. It may sound a little bit comical, but taping yourself during sleep, it's impossible to recall how we sleep at night. And picking up perhaps a habit where during our sleep we turn face down or we bring our hands to our eyes and rub our eyes is very important to be able to prevent it with a measure similar to the one that I showed you. I hope you found this presentation interesting. This is John Kanalopoulos from our Ambulatory Surgery Center here in Athens, Greece, signing out, and thank you so much for your attention.